Welcome to Coruzant Technologies, home of the Digital Executive Podcast. Do you work in emerging tech, working on something innovative, maybe an entrepreneur? Apply to be a guest at www.coruzant.com/brand. Welcome to the Digital Executive. Today's guest is Mohammad Noshad. Mohammad Noshad is the CEO and co-founder of Shield AI, where he is pioneering the use of physical AI agents to bring real-time operational intelligence and automation into hospital environments. He also serves as a strategic advisor at Field AI. With a background in electrical engineering and a PhD in AI, he led cutting-edge research at Harvard University in AI and machine learning. His work has been cited over 2,400 times and has received several Best Paper awards. His experience spans robotics and space connectivity, and he is now focused on building technology that helps save lives globally. Well, good afternoon, Mo. Welcome to the show.
Awesome. Thank you, Brian.
Absolutely, my friend. I appreciate it. I really do. I know you're in the San Francisco Bay Area. I'm in Kansas City, just a couple hours apart as far as time zones, but I know it's challenging to work through calendars. So I just appreciate you being here, and I'm totally excited to jump right in. So Mo, your path here is fascinating. Electrical engineering, a PhD in AI, leading cutting-edge research at Harvard, work spanning robotics and space connectivity, and now co-founding Shield AI with your brother, Morteza. Take us back to the beginning. What drew you to this AI and machine learning in the first place? And what were the inflection points that took you from academic research with over 2,400 citations to building a company focused on saving lives in hospitals?
Yeah, thanks, Brian. Thanks for having me. So when I did my PhD, this was back in 2013. At the time, it wasn't called AI. It was mostly machine learning people were referring to. And it was one of the fascinating areas for me personally, looking at how these systems can basically predict different outcomes and work to learn different behaviors of these systems. So that was motivation for me and my co-founder and brother, Morteza, when he basically did his PhD at University of Michigan in Ann Arbor. And after my PhD, I moved to Harvard. I was working on a lot of exciting projects over there with an amazing team. And after a few years there, in 2016, I met a program director at Department of Energy, and they had a program called SBIR. And I thought it would be interesting to build a system based on that. So that was the story of kind of like my first company. That's how I left academia and decided to start first company, which was interesting kind of like technology we were building. And after that, it was second company, which was even more exciting, using lasers in space to connect satellites in LEO orbit, which basically the same technology that's being used with SpaceX, Amazon Kuiper to establish the backbone of connectivity across all of those satellites in space. And then after the exit of the second company, this was 2022, me and Morteza had a friend who passed away because of his surgical site infection. So that was a moment for us to learn about kind of like this problem in healthcare. And we thought with our training in AI, there is a great opportunity to build the next company in the healthcare space.
Thank you. Appreciate the backstory. And story starts out great, did some awesome things in academia, higher education, and then you jumped into entrepreneurship and founded a couple companies. But the touching part of the story is obviously you lost a friend, you and your brother, from a basically side effect of a surgery. And it certainly made you think about how do we take healthcare more seriously. And I love this part. I worked in healthcare most of my life on the technology side, so I can totally appreciate that. But I appreciate you sharing the story and jumping in to try to solve a big problem in the healthcare space. And Mo, you've drawn a sharp distinction between passive AI and active AI. Most healthcare AI today observes, summarizes, or predicts. Shield's agents actually execute, disinfecting rooms, tracking OR turnover, flagging missing supplies. Why is that distinction so important? And what changes for a hospital when AI moves from advisor to operator?
Right. So in healthcare, I would say healthcare has probably one of the most complex workflows. And, when you provide just information or data for the healthcare workers and you ask to them to change behavior or change the workflow, you're just making it more difficult for them to adopt those technologies. So what the transition we're seeing, not just in healthcare, but overall with agentic AI, is that moving from an AI that provides just information to an AI that's actually getting the work done. And that was our vision for Shield. We wanted to build an AI that is more action-based. It's an active AI that gets the work done within the hospitals. And we basically, every piece of the technology we built at Shield AI was with that kind of like philosophy in mind, and how we can make this adoption seamless by getting the work done, not just providing another piece of information or a dashboard data and asking the healthcare professionals, which have, they have tons of things on their plate already, but how we can get a few of those items off their shoulders and let them focus on more important items and stuff.
Thank you. And I appreciate that. Obviously, you, in your mind, you wanted to set out and make the technology easier to adopt, yet taking off some of that workflow or workload. You did talk about the healthcare, and I truly know this, they have one of the most complex workflows, of course. And so changing a workflow just because, or to add a piece of technology in that process, can really frustrate the clinicians or make it more inconvenient and potentially more unsafe. So I really appreciate you highlighting that and taking the extra effort to make sure that you can integrate something that would actually help the clinician in the process. So thank you. Mo, the Stanford study published in the American Journal of Infection Control showed your autonomous UVC system reduced contamination by more than 93% against a backdrop of roughly 72,000 U.S. hospital deaths annually tied to healthcare-associated infections. Walk us through how the system works, the sensors, the AI decisions, what's happening in a hospital room that a human cleaner can't match.
Right. So I would say infection control and automating disinfection is one of the important aspects of our AI, and how combining it with a well-established technology, which is UV, can make it an order of magnitude more effective. So UV is a proven technology. It's being used in hospitals, but in today's workflow, it's manual. And when it's manual, there's limitations in terms of the frequency and usability of that. So what we showed in that study is that for the first time, we combined it with the AI, and that AI, again, not only just learns and kind of like projects where the contamination is, but actually is taking the action and disinfecting those surfaces autonomously. And that study showed that we're able to get over 93% reduction in contamination in those environments, which can translate to a significantly safer environment for the patients. And ideally, the outcome will be lower number of infections, procedural and surgical environments.
That's amazing. Really appreciate it. Here's honestly how the true power of AI, right? Autonomous disinfectant, basically, or disinfector. But infection control and automating disinfection, I think, really goes hand in hand here. We do know that a lot of UV is great. Problem is it's done manually today. But with your platform, you're able to, again, combine those two and reduce those infections and diseases, germs, et cetera, in those rooms. So I appreciate that. Mo, looking for maybe 6 years out, as physical AI agents move from disinfection and operating room optimization into broader hospital operations, as an active AI becomes standard across critical environments, how do you see the relationship between clinician staff and autonomous agents evolving? And what role does Shield play in shaping a future where hospitals are not just smarter, but measurably safer for every patient who walks through that door?
Right. So we started with UV disinfection, and we're already seeing a great speed of adoption within hospitals because now they don't need to change anything. They don't need to change behavior. And our sales cycle is significantly fast. It's weeks. We're able to get these devices in, and it's working in the background. It's not interrupting or changing any workflow. But now with that, we are expanding to even broader areas on where we can use that active AI to take a role And whether it's an operating room, identifying what is missing in basically an operating room before before the surgery starts. And we have these devices that basically have speakers, and they can communicate to the staff right in the room so that we notify them if there is, let's say, 5 missing items, supplies, tools. We prevent basically interruptions during the surgery. Now, that can significantly save time, reduce basically unintended delays for that case. But at the same time, it provides a safer procedure for the patients, because each of those interruptions potentially can increase complication and infection risk. That's just one example. And, when we look at a broader view, one of my personal exciting kind of like aspect of this is these devices, we look at them as the brains of these rooms, whether it's an operating room or now we're expanding to ICUs, med-surg, emergency rooms, and how we can leverage this brain, because now they have been learning, right? So we're passing that kind of like early stages where, we put these devices in, they have seen enough cases, enough procedures, and now they have become more competent in terms of understanding the environment. They now know all the tools in each case, what is kind of like the workflow like, right? So learning the workflow, learning different items that are being used. And then, so this is the brain, how we can bring more muscles into the OR, and that could be robotics, from humanoids to other forms of robotics. Shield is basically providing that connective tissue and coordination layer, right? But now, because of the knowledge we have, we know at each time what's needed in each room, or what the room setup should look like, and how we can leverage that, let's say, humanoid robot to move from an area and bring an item into the room, or help with that room setup before kind of like the first case during the day. So that's a feature I'm personally very excited about, and how this can transition healthcare into a much more effective and efficient environment, reducing the costs, reducing the waste, and providing a much safer environment for the patients, and an environment that's pleasant and more convenient for the staff to work within.
That's awesome. Really is. And I know that you started out with the UV disinfection, but then you kind of moved into that really accurate, the inventory and asset management piece of it, which I thought was interesting, because things happen, especially with humans. We forget to put something in a room for a procedure or a case, and interruptions are just the worst. It obviously, as you said, brings potential room for error or introduce additional infections into that environment. But at the end of the day, you're reducing overall that cost and that waste, and making things way more efficient. So I really appreciate it. As you know, I just love healthcare. It's been really where I spent most of my career. So I'm very, very hopeful, and I want to hear more about it in the future. And Mo, it was such a pleasure having you on today, and I look forward to speaking with you real soon.
Awesome. Thank you for the opportunity, Brian. It was great speaking with you.
Bye for now.